our agency before we begin with the presentation. So how many of you are willing to reveal that you're Medicare eligible already? Okay, so several, and how many people are going to be retiring soon? Okay, so sort of an even split. Okay. All right, so this would be relevant to both groups. So we're essentially going to be providing an overview of the Medicare program, essentially the benefits, the cost for that beneficiaries would have if they don't have retiree coverage is going to supplement the Medicare, essentially how Medicare benefits work, and then a short discussion of appeal rights. Okay? All right. So just to give you a little bit of background about our agency, the Center for Healthcare Rights is a nonprofit healthcare advocacy organization. We've been in existence since 1984, so we have a 30-year history of providing Medicare advocacy and health insurance counseling services here in LA County. We are not part of the Medicare program, but we do receive both state and federal funding to provide our services. And we don't endorse or recommend any particular insurance product. So our goal is to help you make better decisions by providing you with information. But you're the decision maker. Our funding is provided primarily through the California Department of Aging Health Insurance Counseling and Advocacy Program, which is a statewide program here in California. Every county has a HICAP program. Here in LA County, we actually have two, one for the city of Los Angeles and one for the county of Los Angeles. And also across the country, there is similar services under the federal Medicare SHIP program. All right, so probably many of you know who have Medicare already. Medicare is a federal health insurance program. It's a national program, and it provides health insurance provides health care benefits for people who are either age 65 and older and receiving Social Security retirement benefits, or under the age of 65 who are receiving Social Security disability. So those are our primary populations of the Medicare program. Medicare eligibility is not based upon how much money you have or how much resources you have. It's based upon primarily your eligibility for Social Security benefits. Okay, so people who are eligible for Medicare are age 65 and older and entitled to Social Security benefits under their own work record, or may be eligible as a spouse under a spouse's work record. And to claim benefits as a spouse, you have to have been married to that person for at least 10 years, and the divorced spouse are eligible for the benefits as well. Persons who are eligible for Medicare based upon disability are eligible or are receiving Social Security disability benefits. They also may have end-stage renal disease, which means that they're in dialysis, or they may have ALS. But again, just having the disease is not sufficient for Medicare eligibility. You have to be eligible for Social Security benefits. Now, there are a group of people who are eligible for Medicare as long as they meet these minimum requirements, but they would normally have to pay for their Medicare benefits. So they are age 65 and older, they're U.S. citizens or permanent legal residents, and they have lived in the U.S. for at least 5 years. So if they meet all those eligibility requirements, they can pay into the Medicare program in terms of the Medicare premiums. Now, applying for Medicare sometimes is a different timetable. So many people, when they're retiring, they're delaying receiving their Social Security benefits until they're fully vested at, let's say, age 66 or 67. However, people need to remember that they need to apply for Medicare at 65. So if any of you are delaying your applications for Social Security benefits till you're a little older, you again have to remember to apply for Medicare if you're actually retiring from your job and you're not going to be covered by an employer health plan. Okay, now let's look at the Medicare premium. So all of you, I assume, are eligible for free Medicare Part A, meaning that you may be eligible for Social Security benefits, and under that basis, you're eligible for free Part A. If you're not eligible for free Part A, then as a voluntary enrollee, you would pay for the Part A benefits, and the premium is identified here. So if you have less than 30 work quarters, it's $422 per month. If you have 30 to 39 work quarters, it's $232. Okay. Now everybody pays for Part B, unless you're Medi-Cal eligible. So, sorry about that. So if you're eligible for Medicare Part B, or you're enrolled in Part B, most people this year are paying $134 per month. About 28% of Medicare beneficiaries are paying less, but most are paying $134 per month. Now, high-end Medicare beneficiaries, high-income Medicare beneficiaries, and I assume there's a couple of you here, also pay. You want me to say? Okay.
The button on the bottom.
All right. Can everyone hear me? Okay, so high-income Medicare beneficiaries also pay an additional amount for their Medicare Part B. And those folks are identified by if they are single and earning $85,000 or more, or if they're married and they're earning $170,000 or more. So those folks pay not only the $134 per month, but an additional amount that's based upon their income. And if any of you, are high-income Medicare beneficiaries, there's a really good pamphlet on the Social Security website that sort of explains how much more you pay depending upon how much your income is. It's sort of graduated, in terms of how high above the 183, 85, or 170,000 you go. Can we hold the questions? So if any of you have questions, if you could just write it down and we'll take the questions at the end. Okay, now, this is an important point, is that there are penalties for late enrollment. So if you enrolled late in Medicare and you haven't been covered by an employer health plan based on active employment, you have a penalty. For the Part B, the penalty is 10% for every 12-month period that you're late. And it's in effect for life. So we get calls on a regular basis from beneficiaries who say, well, the government should have reminded me, or nobody told me. Unfortunately, the government doesn't believe that you need to be reminded, that that's your responsibility. So it's important to enroll on time, again, unless you're covered by an employer health plan based on active employment. So these are the Medicare enrollment periods. So most people enroll during their initial enrollment period, which is a 7-month period around their month of eligibility. So for most of you, I would assume it's your 65th birthday. So you can apply for Medicare 3 months before your birthday month, 3 months after your birthday month. Most people apply during the 3-month period before their birthday month, in terms of making sure that by their birthday month they're actually eligible. Now again, if you apply for Social Security benefits early, then you will just get your Medicare card in the mail. If you haven't applied for Social Security benefits, again, you need to remember to apply for your Medicare. Now there is also what we call the general enrollment period. And the general enrollment essentially is the opportunity to enroll if you missed your initial enrollment period. So let's say you didn't enroll during the initial enrollment period. There's always the general enrollment period to enroll. It's January through March, but the benefits are not effective until July. Now the last enrollment period is what we call the special enrollment period, which essentially is triggered by your employer health plan terminating based upon active employment. We'll talk a little bit more about that. And that special enrollment period is available as well. Okay, so let's talk about the relationship of employer health plan coverage and Medicare. We get a lot of calls from people about this because increasing numbers of people are turning 65 but delaying their application for Medicare because they're covered by the employer health plan and either they are working or their spouse is working. So this is how it works. If you're turning 65 and either you're working or your spouse is working and you're covered by that employer health plan, you can delay your enrollment in Part B as long as that employer has 20 or more employees. Okay? So essentially what happens is, let's say you're turning 65 in April. You're covered by an employer health plan, you are still working, and you can delay that application for Medicare until the employer plan stops and you're no longer working. Okay, now one point I want to make is very important is that COBRA does not count as an employer health plan. Okay, so when people get caught in that frequently, they'll say, well, I had the COBRA, what's the problem? The problem is it doesn't meet Medicare rules as an employer health plan. So it has to be an employer health plan based upon your active employment. It can't be COBRA. Okay. Now, for someone who is Medicare disabled under the age of 65, they also have the right to delay their enrollment in Medicare if they're covered by an employer health plan, but the number of employees has to be 100 or more. Okay, now let's say you enroll in Medicare anyway. You're turning 65, you're covered by an employer health plan, but you enroll in Medicare anyway. You have your Medicare Part A and B. In that situation, the employer plan is primary and Medicare is secondary. Medicare doesn't pay as an alternative payer. So sometimes people say, well, my employer plan is an HMO, and I thought that I would use the Medicare as sort of an alternative coverage. You can't do that. Medicare is secondary to the employer plan. Okay, now let's talk a little bit about Medicare benefits. So the Part A benefit includes hospital services, skilled nursing facility services, home health, and hospice. Okay, those are the key benefits under the Part A hospital insurance benefit. Now, in terms of the Part A, one question we get is, well, what is the hospital? What is the hospital benefit cover? Well, think of it like a hotel. It's the room and board charges. So the benefits that you see on this slide is what would be on the hospital bill and what would be billed to Medicare as the hospital bill. Now there are what we call ancillary services. So if you have, let's say, x-rays, a CAT scan, or MRI, those aren't part of the hospital bill. Those are Part B charges that are billed to Part B separately. Now, the skilled nursing facility benefit under Medicare is the only nursing home benefit that Medicare pays for. And you can see that it has a lot of requirements to use it. You have to have a 3-day prior hospital stay. The stay has to be ordered by a physician. The facility has to obviously contract with Medicare. And you must need daily skilled nursing and or therapy services. So if you don't meet all the criteria identified, you can't use the benefit. Okay? And what's important to understand is this is a medical benefit. This is a benefit that you would normally use if you, let's say, were in the hospital and you need rehabilitation services. That's generally a situation where someone is using it. They're either getting skilled nursing or therapy services after a hospital stay. It's not custodial care. It's not someone who's a frail, senior who just can't take care of themselves anymore, can't live at home, have to meet this criteria. Okay, now Medicare Part A has co-payments, and it's my understanding that you guys have a pretty rich retiree health benefit package. So if you didn't have that, these would be the types of co-payments that you would be paying on your own. But because you have retiree health insurance, those co-payments are being covered under your retiree package. So you can see, the first day hospital deductible if you're in the hospital, the skilled nursing facility stay, first 20 days are covered by Medicare. After that, you have a co-payment for days 21 through 100. Now, one thing that is important for beneficiaries to understand is that Medicare calculates how many days you've used. And this might not be that relevant to you as younger beneficiaries, but as you get older, you're more likely to use your days, particularly as someone gets very frail and they're going in and out of the hospital or maybe into a skilled nursing facility. So if you look at this slide, you see that Medicare calculates your days. So the days that you use is based upon a concept called a benefit period. So a benefit period begins when you're admitted to the hospital and ends when you're out of the hospital or have not used skilled nursing facility days for 60 days. So let me give you an example. Let's say you go into the hospital in January and you're there for 5 days, okay? You leave the hospital and let's say you develop complications 2 months later in March. Because you've been out of the hospital for 60 days, when you go back in, you're starting with day 1 again. So the 5 days you used in January, you go back into the hospital in March, you've been out for 60 days, you're going to start with day 1 again in March. But let's say the scenario is different. Let's say you're going in and out of the hospital. You're very ill, you've got multiple conditions. So let's say you go in the hospital in January for 5 days, and then 2 weeks later, you're back in the hospital again. Well, in that situation, the first day was 5 days. When you go in the second time, you are on day 6 because you haven't been out for 60 days, okay? Okay, let's talk a little bit about the home health benefit. How many of you are caregivers? Anybody here? Okay, so some of you. So one misconception that people have when they're new to Medicare is that Medicare will pay for custodial care at home. And that's not the case. What Medicare pays for is skilled nursing or therapy services in the home. So you're getting physical therapy, speech therapy, a nurse is coming out, let's say you have wound dressing or something like that. They're paying for the same types of services that you would receive in a skilled nursing facility, but it's at home and it's less frequent. So you have to meet the requirements as you see it on this slide. So again, you're getting skilled nursing or therapy services. You have to meet the definition of homebound. And homebound means that you leave the home with difficulty, meaning you use a cane, walker, or wheelchair, or someone has to help you physically leave the home. In addition, the doctor has to prescribe the home health and set up a plan of care with the home health agency. And again, the home health agency has to be a Medicare provider. So you can see that there's a lot of rules in terms of using this benefit. And again, these are the types of services that you would be getting potentially under the home health benefit. Okay, let's talk a little bit about Part B services. So Part B is the outpatient side of the Medicare program. This is where Medicare pays for a whole range of all physician services, ambulance, x-rays, preventive health services, mental health services, whole range of outpatient services are covered under Part B. And the reason that that's important in part is because of the way Medicare pays for outpatient medical services. So you have to meet your annual Part B deductible, and that's $183, and I assume whatever insurance you have covers the deductible. In addition, there's a 20% co-payment when you use services. So let's say you go by ambulance to the hospital. There would be a 20% co-payment on that. If you see Medicare providers who do not take Medicare assignment, there would be an additional 15% above the approved charge. Okay. But again, I would, all your cost sharing, I assume, is covered through your retiree coverage. Okay, now Medicare has been very aggressive about paying for preventive services for the last several years. So, Medicare pays for free mammograms for women age 40 and older, the screening pap smears and pelvic exams every 2 years, free colorectal cancer screening, free flu shots, diabetic screening. I mean, there's many, many preventive benefits. So if you're interested in sort of checking out the preventive services, visit the Medicare website and just, type in preventive benefits, and they have lots of good information on the various preventive benefits. A couple of benefits that I want to emphasize today is during the first 12 months that you have Medicare, you are entitled to a free physical exam. Medicare does not normally pay for free physicals, but during the first 12 months you have Medicare, they do pay for a physical, and it's called the Welcome to Medicare physical. After that, after the first year, then Medicare pays for what they call an annual wellness visit, which includes a comprehensive health assessment. And that wellness visit is designed to help you and your doctor identify, any health conditions that you may have or may be at risk for, to develop a plan of action of how you're going to address that, and keep you healthy. So Medicare covers both. Something that is not on this slide as well is that Medicare also now pays for the last few years. In 2016, they started paying for end-of-life discussions with your physician. So if any of you want to have those discussions with your doctor, Medicare actually does pay for that as well. Okay, now Medicare has an appeals process, so if you, every time you use services, medical services that Medicare pays for, you get what's called a Medicare summary notice. So let's say you get a Medicare summary notice and they denied payment on the claim, and you don't quite understand why. We see this a lot, unfortunately, with ambulance trips. And you have the right to appeal. You have the right to appeal. So this slide identifies the various stages of the appeals process. So the initial determination, redetermination, reconsideration. So if anyone thinks they might need to file an appeal, our agency would be happy to discuss the situation with them, sort of give them an assessment of what we think their success would be, and if they need help, we could determine if we can help them. Now, in addition, Medicare has an appeals process for service denials, and these are the key situations where these service appeal rights apply. So, let's say you have a hospital discharge situation. So, let's say you're in the hospital, you've been there for a couple of days, the discharge planner comes into your room and says, the doctor thinks that you're well enough to go home, we're going to be discharging you tomorrow. If you or your family disagree with that assessment, you have the right to file an appeal with Levanta, which is the QIO for California, and you would call that 800 number. Keep in mind that 90% of the time Levanta will probably rule in, not in your favor, but it's important to know that you do have those appeal rights if you think you need to use them. In addition, the appeal rights also apply to termination of skilled nursing facility services and home health services. Now, with regard to the skilled nursing facility and home health, if the skilled nursing facility services are being terminated, they have to give you 2-day advance notice, written notice, and for the home health, they have to give you two visits in advance. So you would get your notice 2 visits before the termination would occur, and it has to be in writing. And again, you would contact Levanta if you want to appeal. Okay, now you guys have your own prescription drug coverage, right? Okay, well, Kaiser is an MAPD, so let me just sort of walk through this a little bit. So your prescription drug coverage, if your retiree package includes a Part D plan with wraparound coverage, so I assume that's what the Kaiser plan is. Essentially, Kaiser is a Medicare Advantage drug plan, but with extra benefits that you're getting through your retiree package. So when you're in Kaiser, you are getting all your Medicare covered services, A, B, and D, sort of all under one umbrella. And enrollment is voluntary. You don't have to enroll. Now, I don't know if this is that relevant to you, but for beneficiaries who don't have retiree coverage, essentially the way the Part D coverage is crafted is that there's an initial coverage period, a coverage gap or donut hole period, and then the catastrophic limit. But this may not be relevant to you guys. All right, looking at this slide here, this is essentially when we talk to people on the phone and they're new to Medicare and they don't have retiree coverage, we sort of try to help them, guide them in terms of how do you want to use your Medicare? Do you want original Medicare with a supplement and a Part D plan, or do you want to go into a Medicare Advantage plan where all your Medicare benefits are under one umbrella? And so, generally those are sort of helps guide people in terms of what their options might be. In our community, we have a lot of people in Medicare Advantage plans. So there's probably more than 50% of Medicare beneficiaries in LA County are in Medicare Advantage plans. I think that might be our last slide. Oh no, I forgot. Okay, new Medicare card. Okay, so hopefully all of you will take this fact sheet because it basically provides you with an overview of the rollout of the new Medicare card. So essentially what's going on is that you can see on this slide that the old Medicare card, or the current Medicare card, is on the left, and the new card is on the right. So the new card will replace the current card, and what's being taken off is the Social Security number, okay, because that's a primary way that bad people commit Medicare fraud, is by stealing Medicare identities. And it's a $1 billion industry right now. So because of that, Medicare is replacing the Medicare card with what they call a unique ID number, which you see on the right here. In addition, you don't put your name, you don't sign the card, your sex is not identified. So that whole identity issue is taken off. Now, during the transition period, people can use either card. So the whole process nationally is going to start April 2018 and end April 2019. California is at the front end. So people in California will receive their new card between April of this year through June of this year. So all of you who have Medicare would be receiving a replacement Medicare card during that April through June period. Now, let's say you don't get the card, you don't need to freak out, you can still use your old card. Now, Medicare in their publicity is telling people to tear up the old card. I don't know if that's such a great idea, but if you want to, you can. But again, in other states, people will get their new card sometime throughout the year starting in April. But again, if let's say you don't get the new card as expected between April and June, you can continue using your old card for the time being. Okay. All right, and if any of you have questions that you don't want to discuss today, you can always call our 800 line, which is listed on all our material. So, you have for questions or no?
Can I just cover one thing before we start asking you questions? Can everybody turn to page 4, please, under Medicare enrollment periods?
And everybody turn to page 4, middle section, Medicare enrollment periods. Just want to let you guys know how the Relief Association is going to reach out to you prior to your 65th birthday. So at Tuesday's seminar, there was a statement made that nobody's going to contact you. So I want to just clarify, we did for that session also. This is how we reach out to you. So basically, at 3 months, it's about 105 days prior to your 65th birthday, we're going to send you a letter with all the information on what things that you need to do to enroll for Medicare. Please open your mail. You get an envelope from the Relief. All the information is going to be in there. It's going to tell everything you need to do. If you don't open that and you don't respond to us, in another 35 days, we're going to send you another one. And if you hopefully you open that one if you haven't opened the first one. So it's going to happen 3 times, basically 3 months, 2 months, and 1 month. At the 1 month period, you're gonna receive, it's basically a term letter. If you don't sign up for this now, you're gonna be termed from the plan. So, and one of the reasons why it's important is because, and Anna, please help me with this, but if you don't sign up, there's a 1-month grace period for the pension department. If you don't sign up for these Medicare benefits, then the pension department is going to stop your subsidy. Okay, correct? Okay, so it's very important. These other periods down below, the general enrollment period, special enrollment period, we don't want to go into that. We want to stay in the initial enrollment period. We want it at the first time we send you out the letter, please open up the mail and start applying. Get it done as soon as possible. Okay? But look for that in the mail from the relief, and all the information will be in there on how you want to sign up.
That's a very important point, because we get referrals from lacers, the city retirement system, all the time, for people who, again, don't open their mail and don't enroll. And by the time they contact us, their benefits have been terminated because there's no enrollment in Part B. So it can get really serious. So that just point is really well taken. So let's open it up for questions. If any of you have questions that you wanted to ask, maybe during the presentation. Yes.
Let's, oh, you got it? Oh, you got it? Okay, perfect. That way everybody.
With the new cards, what's to prevent people from committing fraud with the new ones, with that ID number rather than the social security number?
Well, that's a good point. I don't know. I mean, I assume Medicare has sort of thought about that, because there's been a lot of money rolling out the new cards. So there must be, they must have some safety mechanisms in place.
I'm just guessing, but I would think it would be like when you run credit checks, they're asking for your social security number rather than your Medicare ID number. So that'll be one way for your social security number to not be out there on that new card.
Okay, and the gentleman in the back.
If you have a private long-term care program, insurance that's already paid, does Medicare go in front of that and then they go after, or?
No. Well, the issue would be, does it include, without looking at your long-term care insurance, most of the newer long-term care insurance essentially are focusing on providing custodial care, assistance with personal care, which Medicare doesn't cover. So by buying a long-term care insurance policy, you're buying something that is closing a gap in terms of what Medicare does not cover. So I would assume that your policy doesn't cover skilled nursing facility services. Okay, other questions that people have?
We have a rebuttal to that. Sorry, wrong words.
No, so we don't have long-term care actually as part of the medical benefits, but a lot of you have them if you signed up through Unum. So definitely check on that, because we have members currently who they're very, very ill, so they have kind of exhausted the hospital, the acute medical center, and now they're ready to go home, and their main caregiver can't really handle, when you're bedridden. So at that point, the medical plan will not cover that, and nor will Medicare. So you're lucky if you have the long-term care.
Yeah, I mean, it's basically filling a need that is not being addressed by Medicare. Okay, other questions that people have? Yes, sir.
Yeah, Congress is always talking about making changes to Medicare. Do you have any idea what they possibly might be?
Well, if you look at the policy or Medicare reform proposals that were brought up, let's say in 2016, 2017, they're not anything new. So one is raising the Medicare age to 67. Another is modifying the Medicare program from a defined benefit package to essentially you would get like a stipend, X number of dollars, and then you go in the marketplace and purchase your own insurance. That's another suggestion. Another suggestion is increasing the Medicare cost sharing, so that what Congress says that so that beneficiaries have more skin in the game. The concern is that they overutilize benefits because they're not paying as much as they could. So those are all suggestions that will probably be brought out again probably in 2019. Okay, other questions? Okay, oh, let's get somebody new over here. Did someone have a question over here?
Well, right there, where JC, go ahead and have the, right here. I'll do that, that's okay.
Yeah, just to clarify,
You just need a microphone.
the eligibility for Medicare is when you are eligible for Social Security, is that correct?
Or you've paid into the Medicare system?
Okay, now that's just eligible, not actually receiving for those that might delay it.
Yes, exactly. So if you are continuing to work, you have the opportunity to delay your retirement. I mean, they do have that option, right?
But let me just talk about that real quick.
Some of these scenarios were coming up on Tuesday. So if you have your 40 quarters, right, does anybody not have the 40 quarters? Okay. So if you don't have the 40 quarters, you do not qualify for Medicare Part A. If your spouse has the 40 quarters, the day that she turns 62, correct me if I'm wrong, that's what we're being told, that you can then both be qualified under her Medicare Part A benefit. If neither of you have the 40 quarters, you or your spouse, then the Relief Association acts as your Medicare Part A claims.
But I think the question he was asking is, let's say he, at turning 65 and he doesn't want to retire, he still can stay on the employer plan.
Oh, absolutely.
Oh, no, you're actually, once you hit that 65 and you do have your 40 quarters, you must apply, correct?
If
Not
you're,
for
if you're
someone that-
retired.
If
If you're
you're-
active, you can still stay on the boat.
Okay.
Okay, all right, the lady in front?
Yes, regarding what you just said, my husband doesn't qualify for Social Security, but I do, and I am much younger than my husband. I'm a trophy wife. But, so when I turn 62, he can piggyback off of me.
He can claim
He gets
benefits
Part A.
under your work record.
But I believe you said I also at 62 get Part A?
No,
I don't have to wait till
you have to
65.
you have to be age 62. So let's say you were really a lot younger. So let's say he's turning 65 and you're 35. He can't claim benefits until you're 62.
Thank you for that, but he is 5 years older than I am. So when I turn 62, he gets Part A, but do I get it as well, or do I have to wait till I'm
You have to wait
65?
until you're 65.
Okay, thank you.
Okay, other questions that people have? Okay, let's take some of the people in the back there.
Got stood up by Steve Owens first. Nicest guy in the whole fire department. Couple of questions. My wife is 7 years my junior. I can't get anything from her. And she's a trophy wife too, kind of like third place. Not first, but. My question is a couple of things, and that's why some of us have to go back to work to get those 40 quarters. But once I do that and I qualify for minimum Social Security, I'm married to a Lacers retiree. Lacers is putting her Part B premium in her pension. Does our pension do that?
Yes.
And then if I qualify for some kind of minimum Social Security, does Medicare take that money out of my Social Security check too then?
Yes.
Well, basically what it is from my experience with Lacers, is that Lacers is paying the beneficiary, but the beneficiary is having it deducted from their Social Security check.
Correct, she has to pay that.
Yeah.
Okay, and then the next part is if I don't have my 40 quarters and I'm not eligible, she's too young for me to get anything from her, and the Relief Association will pay my Part A, is that correct? And is that more of a premium that I'm gonna pay for that?
Yes, a little bit more.
Okay.
Just didn't want to add. Well, that question.
Hi.
My name's Bernice and I work with communications and education with fire and police pensions, and George works with medical and dental benefits with LAFPP. I just want to touch on a couple of things here. It's really important that you do apply for Medicare 3 months prior to your 65th birthday. So by your 65th birthday, you have to be in Medicare. Based on union negotiations a long time ago, if you're not enrolled in Medicare by your 65th birthday, we basically zero out your subsidy, which means that you can continue to be insured through your association plan, but you're paying 100% of that premium until you can prove that you're fully enrolled in Medicare. If you qualify for Medicare, both A, free of charge, because you have the 40 or more quarters, and you're paying your Medicare Part B premium to Social Security or Medicare, we will reimburse you the basic Medicare cost on your pension check every month. Okay, so that's a benefit.
$134 a month is the base.
Correct. For some higher income earners that pay a higher Medicare Part B premium, we feel bad for you, you made too much money. We can only reimburse you the basic amount of $134, which is what it is currently. For those members that do not qualify for Medicare Part A free of charge, you still have to enroll and pay your Medicare Part B premium in order to continue receiving a subsidy. That's the key thing, is you have to pay for that in order for us to continue to help you pay for that premium. Don't worry about not qualifying for Medicare Part A, because if you don't qualify for Medicare Part A, you get to keep the non-Medicare subsidy, which is a higher monthly subsidy. Once you are eligible for Medicare Parts A and Part B, you go into a Medicare subsidy status. It's lower, it's a lower subsidy, but it's also lower because the supplemental premium through the association is also lower. So Medicare A and B pays your primary claims, the association plan supplements that. Does that make sense? Also, for members that are 65 and still working on the department, they do not have to enroll into Medicare when they turn 65 as long as they're still active. That's the key thing. Once, let's just say that the member retires officially at age 67. When you come through our department, we're going to give you a Social Security form verifying that you had credible coverage under a group health plan so that you're not penalized that 10% for every year that you didn't enroll. So we have you covered in that regard. Okay, and if you have any other questions, just come and see us. Yes, sir.
There's a 6-month gap. I don't qualify for Social Security. I don't have any quarters, but I do through my wife. But she won't be 62 until December. So that gap time is made up by the Relief Association as far as the payment. Okay, but.
So you would enroll in Medicare Part B because you have to, right? Are you retired?
Yes.
Okay, so you would enroll in Medicare Part B because you're retired and we want to continue to help you pay for that premium. So you would fall under receiving the non-Medicare subsidy or the higher subsidy amount. When she turns 62, then you would go pack a lunch, go to Social Security office, run her information, piggyback onto her benefits, right? Then you would receive Part A free of charge. Then you have both parts. Then you're going to communicate to the association that you have both parts of Medicare. You're going to let us know that they're putting you into a supplemental plan. We're going to adjust that subsidy. And then we'll start reimbursing you. You're out of pocket $134 per month on your pension check.
But because she's not 65, won't be 65 for a while, then she just stays on the regular relief plan?
Correct. Nothing changes for her. Her primary plan is still the association plan. For you, you have Medicare Part B medical. Hospital benefits are paid through the Relief Association.
Just real quick on that. The book that you guys, if you didn't pick one of these up,
This is the Medicare Summary Plan document. You can also get this electronically on our website. So in your situation, Lee, your wife would have to look at there's a red book on the website also, so she's going to be under the non-Medicare book. And then all your medical would go through the Medicare book.
I have a wife that's slightly older than I am.
Does she need to apply right at 64?
3 months before her 65th birthday?
If you have a spouse that is older than you, if she's a qualified surviving spouse and you have her on your medical plan, qualified surviving spouses are also required to follow the rules, just like the member. One of the reasons also is because they will also be penalized if they don't enroll. Okay, so if the spouse is turned 65 before the member, you have to also coordinate those services with the Relief Association so that they can put you into, they're gonna put her into that Medicare status. But for you, it'd be the opposite of this other couple over here. Nothing would change for you because your benefits are through the Relief Association, but for her, Medicare would be primary. So at least Medicare Part B to keep receiving a health subsidy. And you enroll in Part A only if you get it for free. Otherwise, then the hospital benefits are covered by the Relief Association.
So I have a question for that, and maybe Anna, you can help me answer that. So in your scenario, if your wife's a little bit older, she's turning 65 6 months prior to you, the member, do we send the letter out to the spouse?
Yes, 3 months before.
Okay. Question right here.
Back to the red book, blue book thing, are there significant differences between what's covered in the red book and blue book, or is that just kind of a back office, how it's paid and reimbursed?
Yeah, it's pretty much the same, it's just how it's all coordinated, I believe.
The difference is pharmacy, so, sorry, I don't know how to do that. So the pharmacy plans are gonna be different, and that is something when either you or your spouse turns 65. The person turning 65 is going to be rolled over to our employer group waiver plan, which is called EGWIP, and that's the pharmacy plan through Express Scripts. So you're both gonna remain on Express Scripts, your benefits stay the same. It's just the person turning 65 will have a greater formula, medications to choose from, and you'll also be able to utilize any retail pharmacy, which, as you know, as an active member, you can use only Walgreens if you're gonna use maintenance medications ongoing for the same price as mail order. So the red book and the blue book, the big difference, really the only difference is gonna be your pharmacy benefits. And also when you do turn 65 or one of the members turns 65 and maybe you leave a spouse or a child on the commercial plan, which is what you're on before you turn 65, you'll get a different a medical card. So you're gonna have your Medicare card with you. Once you turn 65, you're gonna take your new LAFRA PPO medical plan, which won't include the pharmacy line. And then you're gonna get a separate EGWIP basically from Express Scripts, a card for that. And then sometimes people have a work comp card separate and
Very important, that last statement. So, and those cards almost look exactly the same. It's just the one says work comp on it, and the other is medical card doesn't. So be aware of that. You want to trade, JC?
Last one I almost promised. I also have some work comp issues that, I'm going for with doctors and medication, stuff like that. When I'm 65 on Medicare, is that involved in going to the doctor? Do I have to give them Medicare card or for workers' comp, or is it just separate?
Yeah, you definitely show your cards because it's very important that we're able to help coordinate benefits. And there is an advocate on site here, a HealthScope coworker of mine, Wayne Sherman. If you have questions like this, definitely either call me and I'll transfer you over to him, or ask for Wayne when you call the association. We work and coordinate benefits with AIMS, which is our outside vendor that manages all of your work comp cases. So yeah, definitely I try and refer everything over to Wayne, we all do, and he kind of acts as a go-between or the liaison with AIMS. But yes, definitely show your card, your Medicare card, show that card. And that's one of our biggest issues is pharmacy. And that means basically because Express Scripts manages your work comp pharmacy issues, and then our medical plan has Express Scripts. Some people get them a little confused. Make sure you're always presenting the correct card. So if you're going in getting the meds for your back, make sure you're showing them the work comp card. We can fix it, we can straighten it out, but it'll save you a lot of headaches So if you bring your little accordion file with all your medical cards and present.
So Lee, for work comp, Medicare will shut it down immediately. They will not pay if they know it's a work comp issue. Flat out, zero tolerance. If it's work comp, they want you to go back to your employer and do it. And that's what happens, and that's what Denise ends up doing is going back in through the system because they've coded it as a work comp issue.
The medical plan is incredible. I can go on and on. I know I don't have forever. 15 seconds. 15 seconds, not a long time. I used to administer the union's medical plan, and I've been able to compare both. And all the way through retirement, the relief plan is very, very good.
Because I'm here today because I'm almost 65 years old, and I want to see what benefits we are going to get from our Relief Association when we have to turn all our stuff over to Medicare. So I'm concerned about that.
My name's Miguel Martinez, retired. I'm here to learn more about Medicare. My wife, she doesn't have enough credit, so I want to ask questions about that. As far as the medical plan with the Relief Association, I've been happy with it since I joined the department, and I'm not going to change or stay with it. Thank you.